Hello, everyone, and thank you for joining us today. I am Dr. Wilma Wooten, Public Health Officer for the County of San Diego Health and Human Services Agency. Welcome to the 2022 Live Well San Diego 21st Annual Public Health Champion Awards ceremony. I appreciate you joining us today as we recognize the extraordinary achievements by individuals and organizations in areas of public health that protect and promote the health of our community. As you all know by now, this signature event is celebrated annually during the American Public Health Association's National Public Health Week, which is the first week of April. This year, National Public Health Week falls on April 4th through April 10th. This year's theme is Public Health is Where You Are, and celebrates the power of working together to build healthier, stronger, and safer communities. National Public Health Week gives us an opportunity to really focus on ways to create the healthiest environment possible through 7 daily themes. Each theme is posted on our Public Health Champion Awards ceremony webpage, along with additional resources. The first theme is Racism, a Public Health Crisis. Racism, stigma, and discrimination obstruct health and wellness by creating conditions that unfairly disadvantage certain communities. We must continue to find ways to encourage communities to speak out against racism, discrimination, and taking action to tackle these inequalities. The second theme is Public Health Workforce, essential to our future. The pandemic underscored the need to build a more diverse public health workforce to better address health disparities, as well as present and future health challenges. Continuing to fund and fortify a robust public health workforce will protect communities and help people get and stay healthy, both physically and mentally. The third theme is community, collaboration, and resilience. To achieve improved health outcomes for all, we must continue to engage community members in a thoughtful and meaningful way. It is critical that we collaborate, establish community-led, multi-sector approaches to change the policies and systems that hold disparities in place, and in the process, create a more resilient community. The fourth theme is World Health Day. Health is a human right. Social determinants of health impact our lives. To ensure good health is a reality for everyone, we must protect human rights as part of health policies and systems. The fifth theme is accessibility, closing the health equity gap. Community organizations provide preventive, physical, and mental health services, catering most specifically to people with disabilities, students, and unhoused individuals. These services are vital to improving community health and increasing health education. With the support of our medical care system and local community organizations, we can deliver health care to those most in need of services. The sixth theme is climate change, taking action for equity. Addressing climate change alongside other inequities helps improve the health of our communities. Taking action to reduce and halt climate change today will result in fewer disease outbreaks worldwide. We will continue to work with communities to address this global problem by investing in local solutions that meet the needs of communities and by addressing the disproportionate burdens they shoulder. The final theme is mental wellness, redefining the meaning of health. The pandemic has triggered a wave of mental health issues due to personal loss, health worries, financial uncertainty, despair, and isolation. Mental health support and shattering the stigma surrounding mental health is more critical than ever and must remain a top priority. I would like to personally thank all the awardees for their commitment and leadership in building a healthier San Diego County and ultimately a healthier nation and world.
My name is Dr. Elizabeth Hernandez, Director of Public Health Services at the County of San Diego Health and Human Services Agency. Every year, the nation celebrates National Public Health Week during the first week of April. For the past 21 years, in honor of this observance, the county has hosted our annual Public Health Champion Award ceremony. Everyone is essential to improving the public's health. Collaboration, teamwork, and a shared focus have helped to navigate the tough challenges brought on by the COVID-19 pandemic. This year's Public Health Champion awardees embody these attributes. Together, we have implemented tried and true policies, as well as innovative public health measures to best protect our community against COVID-19. I am honored to have been on this journey with you all. National Public Health Week has an increased significance this year, as our nation mourns the loss of more than 500,000 lives to COVID-19. It's a staggering statistic. Over the last 2 years, we have come to truly recognize just how essential our public health efforts and public health workers truly are. Whether they are the doctors, nurses, or other healthcare professionals who have guided the equitable distribution of the COVID-19 vaccines, or the lab workers who found ways to increase capacity for COVID-19 testing and whole genome sequencing, or community healthcare workers who supported efforts to increase testing and vaccinations in their communities. These are the frontline workers of the COVID-19 response, and they have had an enormous impact on the local pandemic response. Today's event celebrates the dedication and leadership of the 2022 Public Health Champions, and congratulations to all.
Hey everyone, I'm Supervisor Nathan Fletcher, and I want to thank you for joining us. I am honored to be here to celebrate some of our greatest modern day heroes. Of course, I'm talking about our public health champions. The challenges and struggles we have endured over the last couple of years have been incredibly difficult. Tough choices and great sacrifices that were made every single day. But not once during the COVID-19 pandemic have you lost sight of the ultimate goal, that being the safety and well-being of San Diegans. Your entire county thanks you for your dedication. As we celebrate National Public Health Week, we look to you to continue your critical work on the pathway to better health, including efforts for those struggling to find housing, those facing mental health and addiction, and those who are on the journey to bring stability to their family lives. For that work, you are and always will be essential. The theme for this year's Public Health Award is Public Health Where You Are. And that celebrates a simple truth. The places where we live, work, and play, those places affect our overall health. And we want to address that too, and do so with an eye towards the future, and a future that we know is endangered by climate change. I was really happy to see that the National Public Health Week this year is highlighting and focused on climate change. We know it impacts us. Sea level is rising, which means increased flooding and erosion along our coastlines. We're facing more intense and unstable weather and storms, along with heat waves and devastating wildfires. These are the negative impacts of climate change that we see right now, and they demand, in fact, they require our urgent attention. The county's new climate action plan is doing just that, with a pathway to 100% renewable energy, clean air, water, and an environment that will help everyone live their most productive and fulfilled lives. Access to parks. We know access to parks improves both our physical bodies, but we also know it improves our minds and our soul. We also know that not everyone has easy access to parks, including the wide open county spaces that we have across San Diego. So this year we are embarking on several steps to help expand that access. If you can't afford admission to one of our regional parks, we're going to cover it. If you can't afford the equipment or training in order to camp or hike or mountain bike, we're going to provide that to you. And if you don't have transportation to get there, hey, we got you covered. But before closing, I want to turn my attention back to the pandemic. You see, San Diego's COVID-19 Clinical Advisory Committee were truly among the stars. This group worked tirelessly to develop recommendations for the equitable allocation of COVID-19 vaccines for our region. They never wavered from doing the right thing. In the face of misinformation, they did not give up. Instead, they educated, connected, and encouraged the public to get vaccinated. Today, more than 93% of San Diegans are vaccinated, and we have lost fewer of our loved ones to COVID than nearly any other community. For our laboratory testing task force, we thank you for increasing and maximizing diagnostic testing and for serving as a model for school-based testing across the state of California. I'd also like to acknowledge all of the community groups and organizations that help us reach out to the most vulnerable populations. Because of your support, we were able to connect and serve those who may have otherwise been unreachable. Your collaboration, your compassion, your dedication were truly invaluable. I am proud to have worked alongside such true public health champions for the last 3 years, and I look forward to what we can do collectively moving into the future. Congratulations, and thank you, everyone.
Greetings, everyone. My name is Nick Mashone, and I'm the Director of the Health and Human Service Agency for the County of San Diego. Thank you for being here today, and thank you for being a champion for public health. For over 2 years, we have been tested like never before in protecting the public's health from the COVID-19 pandemic. And for over 2 years, we have passed with flying colors, all because of you. Collectively, we have conquered one challenge after another. And the truth is, there are still many more challenges ahead of us. I have immense confidence that generations to come will be stronger and inspired by what you have accomplished. It is a privilege to recognize today the progressive partnership and extraordinary support of so many individuals and organizations. All of you have gone above and beyond in your commitment to live well San Diego, truly striving to ensure that every San Diego resident is healthy, safe, and thriving. On behalf of the County of San Diego and its Health and Human Service Agency, I want to sincerely thank you. You are shining examples of what happens when we unite for the common good. Let us continue to light the way for health, equity, and mental wellness together. Congratulations and live well.
My name is Dr. Ankita Kadakia, and I am the Deputy Public Health Officer for the Health and Human Services Agency for the County of San Diego. The pandemic has inspired healthcare leaders to really focus on addressing and overcoming health disparities. In December 2020, the COVID-19 Vaccine Clinical Advisory Committee was formed to guide the equitable allocation of COVID-19 vaccines across San Diego County. The committee is led by the Chief Medical Officer of Rady Children's Hospital, Dr. Gail Knight, the founder of the Multicultural Health Foundation, Dr. Rodney Hood, and myself. The committee teamed up with county and local physicians, nurses, and staff who are working in vulnerable communities hit hard by COVID-19. Together, we developed recommendations for the equitable allocation of the COVID-19 vaccine through discussion, evidence-based medicine, and resources provided from county, state, and national sources. Over the course of several months, this group worked tirelessly to review scientific studies, local COVID-19 data, and state and national guidelines to develop 29 key recommendations made to our public health officer, Dr. Wilma Wooten. Members of this advisory group also joined the county effort to educate and fight misinformation surrounding COVID-19 vaccinations on social media, television, and newspapers and other forums, and to encourage the public to get vaccinated. I am proud to have worked alongside all of the committed and compassionate healthcare professionals who not only cared for vulnerable patients during this unprecedented pandemic, but also collaborated with the county on equitable vaccine allocation. During this National Public Health Week, I would like to thank our healthcare workers for their dedication to their work, for their commitment to communities severely impacted by COVID-19, and for their empathy for those who need them most. Thank you for all that you have done for the residents of San Diego County.
My name is Brett Austin, and I'm honored to have served as the Public Health Laboratory Director for the Health and Human Services Agency for the County of San Diego. In response to the challenges of the COVID-19 demand for testing, in April 2020, the county established the local laboratory testing task force. Our goal was to provide a forum for hospitals and health systems, community health clinics, commercial reference laboratories, and other inpatient and outpatient facilities that perform laboratory testing to engage in mutual problem solving, education, and capacity development to improve overall health in our region. Together with my co-chairs, Dr. Omid Bakhtar of Sharp Hospital and Dr. Ronald McLawn of the University of California, San Diego, the task force members worked tirelessly to strategize how to increase and maximize capacity for diagnostic testing, to utilize test results to inform public and personal health decisions, and implement quality assurance measures for testing. Several working groups were established. One of these evaluated the efficacy of antibody testing, and one group evaluated the use of antigen testing, particularly in schools, to help protect students and school personnel in an uncertain environment. Their findings served as a model for school-based testing that was shared across the state with other school districts. I am proud to have worked with these champions who have helped support equitable distribution of testing resources in the community. During this National Public Health Week, and as we look forward to National Medical Laboratory Week starting April 24, I would like to thank all of you for your tireless, compassionate, and dedicated service to improving the lives of members of our community, not only during this pandemic, but for always going above and beyond in serving the people of San Diego.
What a beautiful day to celebrate public health. Today we honor individuals and organizations for their hard work to keep our residents and communities safe, especially during the ongoing COVID-19 pandemic. I'm Carrie Ricottelli, Director of the Office of Strategy and Innovation for the County of San Diego Health and Human Services Agency. This year, I'm honored to recognize 9 outstanding organizations. Together, they embody the Live Well San Diego priorities of promoting healthy, safe, and thriving communities. These 9 partners have stepped in to assist us in prioritizing public health in the communities hit hardest by COVID-19. They helped us not only increase access, but to do so in a culturally and linguistically appropriate way. This outreach began very early in the pandemic with county contracts that deployed community health workers as partners to help address the disproportionate impacts of COVID-19 for people of color and to prevent widening racial health disparities. In addition, we appreciate these partner organizations that helped us gain insights into how to best communicate with the County of San Diego residents to deliver the right message at the right time to the right people. These insights we gained will help ensure that this model remains a key outreach and community engagement strategy for the County of San Diego. We truly appreciate your partnership in making San Diego a more equitable, healthy, and safe place. Your dedication has made a vital difference, and thank you for all of your efforts as our public health champions.
Well, this concludes the 2022 Live Well San Diego 21st Annual Public Health Champion Awards ceremony. Thank you to our award recipients who have shown strength, leadership, and great success by embracing open, honest, and powerful collaborations. I am proud of the work we have all done together as champions for public health. Thank you for making a difference right where you are. See you this same time next year.